Affairs is on his way and shall be here in about 8 minutes. So please stand by. Don't leave us. Looking forward to having Town Hall with you viewing today. Thank you. Right here, sir. Okay. Okay, waiting for a countdown. Good afternoon, and welcome to a very special Veterans Town Hall coming live from the VA healthcare system in Portland, Oregon. Thanks for joining us, and thanks for waiting for us. We really appreciate that. It's my great honor to be with you today. My name is Jose Llamas. I'm a Marine Corps veteran and a member of VA's Veterans Experience Office in Washington, D.C., and I'll be your moderator. Before we begin, I would like to welcome Senator Ron Wyden from the great state of Oregon. Thank you for joining us, sir.
Thank you.
Also would like to recognize Fritz Graham, Deputy District Director to Congresswoman Andrea Salinas, is representing Oregon's 6th District. Welcome. Thanks for joining us. And then I would also like to thank David Holt. Sir, thank you for you and your leadership, your team, for hosting us today. It's been a pleasure working with all of your staff. And then lastly, I would like to welcome Kelly Fitzpatrick, the Director for Veterans Affairs for the state of Oregon. Thank you for joining us, Kelly. Today, Secretary McDonough will be answering questions, as you can see on the TVs if you're in the audience, from 6 veterans and caregivers from around the country, as well as from you, our audience here today. So please, as the Secretary and I like to say everywhere we go, please don't hesitate to ask questions. We're really counting on you to do so. I'd like to remind you, if you haven't done so already, please silence your cell phones. Truly appreciate it. Thank you so much. Mr. Secretary, welcome to Oregon, Portland. So happy to have you again with us.
Thank you, Jose. It's really great to be with you. And I'm thrilled that we're joined by Senator Wyden, the senior senator from the state of Oregon, chairman of the Senate Finance Committee, which is obviously a very powerful position, but what he has been for us at VA is a tireless advocate for veterans. Somebody who has helped us generate these historically large budgets over the last several years. I'll also say this, and I know he'll know this as a compliment. He also holds us to a very high standard and holds us accountable to deliver what our vets so richly deserve and have so hard earned, which is veteran-centered care. And by the way, he's not afraid to let us know when we're not meeting the mark, as he just did in the back room here. So, we're really pleased to have you with us.
Thank you, Dennis.
So, okay, Jose, let's get the easy questions.
Well, Senator, I can, anything
Yeah,
you'd like to add
please.
before we start?
Yeah, I'm going to make this a filibuster-free zone, folks, but just a couple of quick thoughts. First, big welcome to the Secretary. There are a lot of places he could be today, but he's chosen Portland, Oregon. So we're very appreciative. And this meeting is part of a nationwide discussion. So we're going to have a chance to showcase what we call the Oregon Way. And that is to have a town hall meeting. I've had, Secretary, 1,045 open to all town hall meetings. Had 5 of them just in the last week. By the way, people ask about it, where were they? They were in bright red counties. And that's because we value everybody's voice. It's not about politics. It's about making sure that veterans get a fair shake. And that's what we did, for example, with the Pact Act, with the Secretary's leadership, so that, veterans who are facing this exposure to toxic chemicals would finally get a fair shake in terms of their medical care. It was a hugely important issue and development. And I've stayed on the Senate Budget Committee. Dennis was throwing me all these kind of compliments about the Senate Finance Committee. I've stayed on the Budget Committee so I could help run point on the agenda that ensures veterans get a fair shake. And the last point I'm going to make is it's really all about choices back there in Washington, D.C. And, Dennis worked for a president. I've been in the Senate and the House. It's really about your values. And our values are veterans' values. My parents fled the Nazis in the 30s. Not all got out. My dad was one of the now legendary Ritchie boys who talked their way into our army so they could drop the propaganda pamphlets on the Nazis. So I'm so proud to represent all of you in the Senate. We've had some successes here recently, securing housing vouchers for veterans. The Secretary is particularly interested in that. That's what we were really talking about out there, some of the ways in which government can deliver what are called the wraparound services. In other words, people need help right away. That's important. But then you got to figure out the housing and the medical care and things of this nature. And the last point I'll make is when you're talking about choices, it means that sometimes you have to take on powerful interests. And this last week, the Senate Finance Committee exposed massive, ongoing federal tax evasion with bankers overseas. And greedy banks and greedy bankers basically were involved in concealing $700 million worth of ultra-wealthy accounts. That means they were cheating American veterans and people who've worn the uniform. So I'm really proud to be here with all of you. This is about our choices, our priorities. The Secretary and I are making clear that you're our priorities. So he tried to slip me what is a long tradition in American politics to declare that I was to get the hard ones and he was to get the easy ones. Apart from our friendship, just talk about what's important to you. Don't be shy. The other day, some students didn't ask their questions, and I heard one of them say, "This senator dude is really serious. If we don't ask our questions, maybe he's going to come to our house and ask the questions." We're not coming to your house. We want to hear from you today. And just enjoy the conversation. And to the whole country, come visit. We love having veterans in our state. You'll enjoy our mountains and our shore and a lot of other things in the best place on earth. Thank you. Thank you both. Thank you, Mr. Secretary, for being here.
Mr. Chairman. Thank you.
Thank you, Senator. Appreciate that. Ladies and gentlemen, we have 1 hour. So please, if you have questions in the audience, be mindful of the time so that others may have an opportunity to ask their questions. So with that, let's begin. Our first question is going to come live from Teams from Marty Douglas, a caregiver of a Marine Corps veteran living in Mississippi. Marty, over to you.
Thank you, Jose. My veteran is my husband. He's a Vietnam-era Marine who was home based at Camp Lejeune. He's rated 100% P&T with service-connected Parkinson's disease, and he's very proud to have served. Firstly, the change to the VA mission statement to include caregivers boldly recognizes our role, and I appreciate your recognition of us as the backbone of the care team and fundamental to best outcomes for veterans. As well, kudos to your department for recognizing the need for an additional pause in PCAFC reassessments for legacy caregivers, as well as expanding the program to include veterans of all eras. My question is regarding the challenging process currently underway to reassess the VA's PCAFC regulatory requirements, as these are the key to the intake assessment. I was happy to see that in previous comments you stated the department was expressly looking at this component of caregiver assessments. Can you give us any insight into the regulatory reassessment process itself, what the key takeaways have been so far, what meaningful changes we might look forward to, and what standards are being used to assess the thousands of new applicants while the standards themselves are under review? Thank you very much.
Yeah, well, thank you so much. What a wonderful question, and it gets straight to the heart of our ongoing review. I want to just second a point that you made, which is at the heart of why we did change the motto, the mission statement at VA to modernize it. We did not edit President Lincoln's words. We just had a more, settled on a more comprehensive takeaway from the President Lincoln's historic passion and then President Biden's current demand that we fulfill what he calls our lone sacred obligation as a country, which is to care for our veterans, their families, their survivors, their caregivers when they return. And that is, as he says, a sacred obligation. What we know and what we have experienced is that the caregiver is not only part of the care team for our vets, but is, as you said, the backbone of the care team. And so as we're doing this regulatory review, we are making sure that the parts of the review, which is basically is the conditions that the veteran suffering, conditions that resulted from service. That's established in law. We have a proxy for that, which is a certain degree of service connection. That we can't change. What the regulatory review is all around is the second of two-part test of whether a veteran and a caregiver qualify for participation in the program. And that is the amount of daily activities of daily living that a veteran has to have support for to qualify. That is a regulatory decision. That's not, it's based in the statute, but it's not written into the statute. So we're trying to make decisions in the meantime for participation in the program in the most permissive reading possible of that second part test. And then as we build a new regulatory infrastructure for the legacy program going forward, we're trying to make sure that we go back to the basis, the genesis of the program, to hear from caregivers themselves. So we're engaging in caregivers in their communities, in forums like this to have the new regulatory framework based on the lived experience of our caregivers. So this is going to be an iterative process. That's why we gave ourselves 3 years to make this regulatory framework, to build this new regulatory framework, and then make sure that it's subjected to, as appropriate, public comment and public review. So we're going to be coming back to you and to other caregivers to make sure that we understand your experience to date, so that as we get this next iteration of the program, for which Congress, House and Senate, Republicans and Democrats have been very generous, that we can assure them and assure you that it's not based on some sociological experiment, but this is actually based on the lived experience of our veterans and of the backbone of our care team, namely the caregivers. So this is an ongoing conversation. We have until September 2025 to make sure that we get it right, and we're going to take that time to get it right.
Ma'am, I would only add that what you've heard from the Secretary is a commitment that reflects the reality, and that is, if government doesn't have smarter caretaker policies, very often you will have 2 people in need of health care because the caretaker won't get any relief. And I taught gerontology for a number of years. I was director of the Gray Panthers, a senior citizens group, for a lot of years. And when I came to the Senate, because health care has sort of been my specialty, everybody tries to become marginally understandable at something, and health care has been my specialty. I said, we're going to try to make sure, in terms of every part of this $4 trillion plus healthcare system, we get it right on the priorities. And particularly now with Medicare expanding and a big fiscal challenge, we're going to have to do, as the Secretary said, what's smart and what's cost effective, and taking care of caretakers so they can take care of patients is right up at the top of the list.
Here, here.
And Marty, I know you know this, but for those folks who are in the audience here today and watching who happen to be a caretaker, you can get more information and read what the Secretary has just mentioned at the caregiver.va.gov. So it's a good resource that we provide to caregivers out there who have a lot of questions. So please visit our website for more information.
Marty, make sure you tell that Marine of yours that we sure appreciate him too.
Thanks, Marty. For those in the audience, if you have a question, please raise your hand and one of the folks here will come to a microphone. Sir, do you want to stand up, say your name and where you're from?
I'm Skip Alton. I'm from Hillsboro, Oregon. And I'd like to thank the panel for inviting us today. And Senator Wyden, I know you've done a lot of things for the veterans.
Thank you.
We may not agree on everything, but,
My wife doesn't agree with me on everything.
Oregon probably has one of the best in the United States for health care, so we appreciate that. My question has to do with comp and pen, and some of the people I talk to, a lot of veterans, and they have problems with missing records.
Yes.
But the other thing is, can we start some kind of a buddy program or something so we can tell what is happening inside comp and pen? We don't get a copy of the letter. And I talked to many veterans, and they all seem to have the same complaint. They go in, they talk to a doctor, and the guy, oh, I see what your problem is, and oh, you're going to need a new knee, you're going to need this. And then they go in, and it's all service related. They've got buddy letters for it. It seems like they're cherry picking certain buddy letters and certain dates. And then they get a turn down, and sometimes they get the records back, and the turn down isn't the information they gave the doctor. So it's like you're telling the doctor this. One guy was telling me about a shoulder problem he had, and because he'd had one shoulder operated on, and he was supposed to get the other one operated on, they kept going back to the first shoulder and saying, well, he has pain there. No, it was the other shoulder. Yeah. So we have no way of seeing those records, and then it's deny, and it takes these guys years to get these claims through.
Yeah. Skip, thank you for the question. Thank you for hosting us today. And I say on behalf of a grateful nation, thank you and welcome home. The comp and pen exam is the source of some considerable frustration. It starts with the first issue, which is too often it doesn't feel like an actual healthcare exam. We rely overwhelmingly on contracted providers to carry this out because, frankly, if we did all of our comp and pen exams in the VA hospital or in our C box, that comes directly out of the time for other healthcare visits. So we rely on contracted examiners for up to 90% of the C&P exams. But we have heard concerns about quality that you're talking about. So one, I want to make sure that any veteran who has had a comp and pen exam and you feel like it does not accurately reflect the situation, please seek higher level review or even eventually seek an appeal, okay? I know that you made an important point, which is sometimes veterans are appealing and it ends up taking years, and it ought not. But make sure that you exercise the rights that you have. That's point one. Point two, we are very focused on this being a quality exam. And so we are building into these relationships with the contract providers certain incentives and, importantly, disincentives for how they carry out the exams. Are they timely? Have they been moved around? Does a vet turn up and learn after driving a couple of hours to get to his exam or to her exam that it's been canceled through no fault of the veterans? So we are using those incentives and disincentives to make sure that it is a quality review of the type that you rightly, Skip, expect. On the question of buddy letters and on the comprehensiveness of the review, that's why higher level review becomes very important. And we urge you, again, if you're hearing from a buddy who's had an exam and he says, look, this thing is incomplete, make sure that you ask VBA, the Benefits Administration, ask us for higher level review. And let's make sure that we're doing our part then to hold the providers accountable to the kind of high quality C&P exam that you're right to expect.
Skip, I've heard about these cherry picking situations you describe as well. So when you're in contact with the department, feel free to utilize the vets who are in our office. I think Eric, where is Eric? I think Eric may be floating around here. There he is. This young man is a veteran himself. We're available to handle those kinds of situations. I've heard the concerns and I share the Secretary's view. They're trying hard to be thoughtful and strike a balance between all of the considerations. I'm glad you brought it up.
Thank you.
Thank you, Skip.
Thank you. Our next question comes from Air Force veteran Scott Case from Texas. Scott, over to you.
Good afternoon, sir. How you doing? This is Scott.
Hey, Scott. Thanks for joining us.
I'm under home-based care. My wife is my caretaker. I have a doctor, Dr. Haressa. He's the best VA doctor I've ever had. My question is, why does it take 3 months to get a home improvement and structural authorization, a HISA grant, approved? I did all the paperwork required, and after 3 months, I was told the contractor bid I sent in was disapproved, and I had to start all over. 2 months after submitting another bid, I'm still waiting, and I still can't get my scooter into my bathroom.
Scott, thank you for that, and thank you for the shout out to your doc. I'm going to track your doc down when I get back to the car here and send him a note and let him know that he got a national level shout out for the care, so thank you for that. I'm sorry that you're having the experience you're having with our processes on home-based care and our support for the home-based care. So the short answer to the question is, I'm going to take this and we'll work it directly to make sure that we address this. The longer answer is that you shouldn't be experiencing this. And, you know, we want to measure our performance based on the veteran experience, not on the inputs into what happens, but on the outcomes of what happens. So that's why for many of these programs, including our support through the Benefits Administration for home-based care, we're going to be starting what we call the V-signal, so that you don't have to wait to have a conversation directly with me or with Senator Wyden to make sure that we have your attention, but that we're surveying you constantly through the administration of the program, so we know whether we're winning your trust and we're effectively addressing your needs. But the bottom line is, this is a big and complicated program, but that's not your problem, that's my problem. We'll get to the bottom of what specifically has happened here, and as we continue to work with you on various aspects of the home-based care program, let's make sure that we're using the V-signal surveys to make sure that we're responsive directly to your needs.
Mr. Secretary, can I ask Scott a question?
Sure.
Scott, are you receiving a portion of your care, some of your care, through telemedicine, where your providers are in contact with you and your family online?
No, sir. My doctor, nurse, physical therapist, they all come to my house.
Okay. I'm sure we're going to have some questions in the course of the program about telemedicine, because that's, particularly as a result of the pandemic, playing a bigger and bigger role. But the fact that, as the Secretary said, you gave a shout out to your provider and they're coming to your home and you're satisfied with it, we like to have good news. Thank you.
I enjoy the program, thank you. And I did get a letter from the VA for approval on my HISA grant a week after I submitted this question. So it has been approved, just waiting on the contractor.
I'm curious how that works, huh, Scott?
Yeah. Thank you.
Thanks for sharing.
Thank you for your patience, brother.
Yeah. And those listening in today, the V-signals that the Secretary had mentioned, every veteran who's out there and you receive a questionnaire from the VA, please don't just ignore it. We take those comments, what you say, very seriously, as the Secretary will say, and this is how we make changes to make sure that we're providing a better service for you. So I just wanted to add that.
Good. Thank you, Jose.
Anyone in the audience have a question for the Secretary? Sir?
Good afternoon, Mr. Secretary, Senator Wyden. My question, I'm just going to address the elephant in the room, has to do with the Oracle Cerner EHRM migration.
Thank you.
We have a lot of our fellow veterans who are in possibility of some serious direct harm in Washington and here in Oregon. I know that Senator Patty Murray is also highly involved in this. I've seen some testimony that has been presented online. We just, I guess we all just want some assurances that this Oracle Cerner is going to be held accountable to their deliverables, provide us with an EHRM that is not going to result in significant pharmacy issues. I think that's probably one of the biggest concerns veterans have is, can I get my prescriptions? Can I get my prescriptions on time? And am I getting the right prescriptions? But additionally, we know that this is putting a huge strain on the staff at our facilities here in Vision 20 that are using Cerner, and it is resulting in quite a bit of frustration. We have providers that are leaving simply because of Cerner being too difficult to navigate, and the level of satisfaction is just really, really low.
Yeah.
And I think from a veteran's perspective, we just want to know that we're going to be provided with an electronic health record that's going to make sure that our treatment is continued and continue the high quality that we have come to expect and have experienced within the VA. I've been with the VA since I got out of the military in 1999. I've had a great experience with the VA. I've had almost zero complaints, and the complaints that I have had are probably because I'm just overly stubborn. But we really want to make sure that we're taking the best care of our veterans, and I think the basis of that, unfortunately, because of paperwork needs, is the electronic health record. So I guess I would just like to hear your thoughts, Mr. Secretary, and Senator Wyden. I know you deal with a lot of the other senators that are directly looking into this and are trying to address the problems for us. Thank you.
It's a great question. Can you remind me your name?
I didn't introduce myself. Hi, my name is Sean O'Connor.
Sean. Okay, Sean, thank you so much for the question. Oracle Cerner is the contractor that won a major contract, a 10-year contract, to update our electronic health record at VA. We have we had one of the first electronic health records in all of healthcare.
Right.
And we're really proud of it. I'm really proud of our team for having built it. And it was really care providers, clinicians who built it back in the day. But the fact is it's now dated. And we've been trying as a government for many, many years to address, to update that health record so that everything from the provision of care in the first instance to the marrying of your record, you know, for Skip, the fellows the men and women who are coming in to get their CMP exam, that when we're giving that exam, we actually have access when we have a modern record to not only your record of care in VA, but actually your record of care throughout your time in service, including on active duty. So that's the goal. And we remain fundamentally committed to that goal and getting that record modernized. That we're at year 5 of that 10-year contract. Built into that 10-year contract is at year 5 a review period where we can sit down with the contractor and assess what we need from the contractor, our lessons learned, and so forth. So we're involved in that process right now with Oracle CERN. And we have a bunch of questions for them, and we're addressing them, and we're working them through. Many of them go to some of the issues that you've talked about that lead to some of the provider frustration, what we call end user satisfaction with the program. Our clinicians, how is it working for them? Our nurses, our docs, our social workers, our schedulers. So the next period of this contract, the next 5-year period, is really dependent on what happens in those discussions. Now, those are private, and we'll work those through. But if we're able to get the contract we need for the rest of this period, we are then prepared to make our assessments about where next to go with that updated record, that updated technology, based on 2 things. One, the experience in the 5 facilities that we've had to date, here in this VISN and VISN 20, this region, but also then based on what we're calling a readiness assessment, meaning we will not go to any new facilities. So for example, we won't go to any new facilities here in Oregon until that assessment, in each case, in a case-by-case way, we've determined using that assessment that we're ready, that the providers are trained, that the lessons have been learned from the 5 places we currently are, that we've accounted for those instances of patient harm where we've used the program, and that we're fully transparent with our veteran patients about that decision to go live. So you have my commitment. I think you're looking for my commitment, Sean. You have my commitment that we will deploy this effort only when it's ready and only when we have confidence that it meets our needs, and most importantly, meets your needs.
That last sentence, John, from the Secretary is so huge because he's making a commitment that it's not going forward until things get fixed. As you know, and you were talking about the senators from the Northwest, this is an area I've been very involved in. Orrin Hatch, the Republican senator from Utah, he and I wrote the telemedicine provisions that ended up being what was used for COVID. And we know in COVID is why I asked the previous question of our wonderful vet who was getting home care, whether he was getting some of it. And I'm not satisfied with where things are with Cerner today. And as you know, we've been looking at a lot of the problem in Eastern Oregon and elsewhere. And what the Secretary just said is he's going to work with veterans and members of Congress like myself who are heavily involved in healthcare to do one of two things. Either Cerner is going to get it right, or we'll get somebody in who is going to get it right. Because this, frankly, is the future of American healthcare. Medicare, when I was coming up as director of the senior citizens, it was about acute care. You broke your ankle, you went to Medicare, that was Part A. Today, healthcare is basically about what we're talking about, and particularly chronic care. Our previous speaker, you have challenges with home care or cancer or heart disease, diabetes, COPD, and you depend on those electronic medical records. So I was really encouraged by the way the Secretary responded to your question. We're either going to get it right, and that's what the next few years are about. We're going to get somebody who's more responsive, and I want you to know, as your guy on the finance committee and somebody who specializes in healthcare, we're going to stay at it. We're going to work with veterans. We're going to work with the Secretary, because this is too important to make mistakes.
Indeed, very important. Our next question comes from a Navy veteran, Lori Reed from Florida. Lori, ask your question.
Hello. I wanted to say thank you to all the Secretary as well as the senators for being here. Also, I definitely want to thank for the VA representative who is here in the audience, as well as our fellow veterans that are in the audience. I also want to give a shout out to Andy Martinez, who's behind the scenes, who is collectively helped and asked me personally to be here, which is an honor, and also allowing us women veterans and other spouses to participate. So I wanted to definitely thank that. And I'm definitely honored to be here. So what I'm going to be talking about and bringing up is the fact of the women's statistics. As a woman veteran and someone who was a trailblazer in the beginning when females were introduced to combat roles in the early 90s, and also one of the first females on an aircraft carrier to the Persian Gulf, trailblazing is something that I readily do consistently. One of the things I wanted to bring up in the Department of Veteran Affairs in 2021 just recently brought out the median age of women veteran is 52 compared to our men veterans of 64. And part of what I would like to discuss is, as an aging population, one of the things that are looking at or approaching us going into menopause and osteoporosis and multiple different things that are happening, I'm curious as to what is the VA's response to the aging population of our subsect group of women veterans, as well as it being a healthcare disparity regarding taking care of the women issues related to reproduction, health problems, as well as menopause, and that moving forward in our latter years. So thank you very much for the time, and I'm excited and thankful to be here.
Awesome, Lori. What an awesome question. What an honor you do us by joining us, each of you by joining us. Lori, thank you very much. I also just want to, as we say, foot stomp Andy. Andy's just a great teammate, a great partner. You raise a really interesting set of questions. Last year, we provided health care to about 650,000 women. About 350,000 of those women are women veterans are of childbearing age. The fact is that of the cohorts of veterans, you cited that the median age data from 2021. In terms of cohorts, the fastest growing cohort of veterans in VA care are women. So it presents a lot of really interesting questions. I was recently visiting what we call our CLC, our community living centers, what we call our long-term care centers. As a general matter, we have not, even though women have served in every conflict going back to the Revolutionary War in this country's history, we have not addressed the issues that Lori's talking about in a systematic way, because we generally have not had until now women getting care in the numbers that they're getting and care at VA. So this CLC was talking, the leader of the CLC was talking through how she was planning for something that she had not yet had to address, which are geriatric women veterans in that CLC. Moreover, we also know that vets as a general matter have more complicated health pictures. Women vets have more complicated health pictures, including for reproductive health, including things like earlier onset menopause. These are all questions that we now have a full research agenda at VA on, because we have patients who can participate in our research and in our clinical trials. But we also have a fundamental clinical need to address them. So the president's budget, for example, which is maybe our best demonstration of our priorities, Lori, includes investments in women-specific health research, investments in what we call gender-specific or women-specific care providers. So, for example, over the course of the last several years, we've hired several hundred gynecologists. And then we also have historic levels of investment in gender-specific technology. So, for example, mammography. We, right now, only have 80 sites in the country that have technology to give mammograms to our women veterans. We need far more than 80 sites in the country when we have the patient base that we have. So now, we're also referring a lot of that care into the community or to our academic partners. So increasingly, women are coming to us for that care. Importantly, at the same time, we're seeing trust scores of the type that Jose was talking about earlier, the V signal, the surveys we send you after your visits for care. We're seeing our women veteran V signal trust scores going up, but they're still on average about 5 or 6 percentage points lower than the trust scores we get from men. And why is that? Well, we need more gender-specific providers. We need more gender-specific technology. And then we just need a better, more hospitable environment for women to come get their care. And this is the last point I'll say. Lori Reed, as she just said, is a trailblazer. My hunch is she is still
answering that. I really appreciate that. Thank you.
You bet. One last thing on this, though, Lori, before you hang up, or before you go to mute. My hunch or my fear is you still go to a VA facility and somebody comes up to you and says, are you here with your husband, or are you here to pick up your dad? Not knowing, because of a preconceived notion, that not only is Lori a veteran, she is, like all the women veterans in the room right here or on screen, a trailblazing, ass-kicking.
Yes.
And until we have that, until every veteran feels that, we will not be where we need to be. But again, on the questions of research, gender-specific providers, gender-specific care technology, you can see in the budget our priorities there. To their great good credit, Republicans and Democrats, House and Senate, have given us support for that over the last several years. Now it's on us to execute that, Lori.
Lori, I will only say I love the Secretary's characterization of you, the very colorful characterization. And we're probably getting towards the end of the program, and the Secretary is doing great work in an area that sort of underlies everything that we're talking about, and especially Lori, has he responded to you with respect to more gender-specific, providers? The Secretary is going to have to deal with the number one challenge in the system, which is workforce. We are going to need more skilled, caring workers because the workforce is aging now. I find that this is right up at the top of the concerns for Oregon employers and Oregon, veterans. And I just wanted you to know you're going to hear us talk a lot more about this in the days ahead, because I've heard the Secretary speaking to senators, I've heard him speaking to elected officials, and it is an enormous challenge. And Lori, your very thoughtful point highlighted it very specifically as it relates to you and to other women. It's across the board in the VA system, and you're going to hear us talk a lot about it.
Thank you, Lori. Anyone in the audience have a question? Please.
Rachel Rogers from Salem. This is more on continuity of care and accountability for that care. I'm a younger veteran, pretty active. I was diagnosed with a fairly rare degenerative neurological disease, and that was referred out to community care, and I have not been able to receive care in 3 years. I keep having community providers have their services are at capacity, and so my case gets denied and sent back for care. And because of that complexity, providers aren't able to, or they are essentially denying care and or not wanting to provide services. I am unable to get prosthetic care and have not received a prosthesis since 2015. And so I have advocated endlessly for myself and still do not receive care. And I am finding that as a younger, veteran, that I no longer am able to maintain an active lifestyle and want to know what is done or is planned to, be done to help advocate for us.
Rachel, thank you very much for the question, and I'm sorry that what's happening is happening.
Thank you.
And so the first and most important thing is let's make sure that we talk after we go after this, and we'll talk to David too, and let us work that specifically. 1, 2. We do have a challenge, and I think you're referring to it, which is that in the VA system, in the direct care system, we are not as competitive as we need to be to keep specialists. We still have, for example, an aggregated pay cap for certain types of providers that say we can't pay that provider more than $400,000 a year. That's crazy, and that makes us non-competitive. So we're fixing that, working with Senator Wyden and others, and Chairman Tester, for example. So we have to get more competitive, and we have to keep specialists in our system. Third point, we are referring more and more care to the community. Last year, we referred 38 million instances of care to the community. We have to be able to, 1, ensure that that's timely care in the community. 2, that we know what happens when you go into the community, so the records come back to us so we can integrate the care. That's what we provide here, is integrated care, so we see the whole veteran. But 3, we got to make sure that we have a network in the community that has the specialties and the expertises that our veterans, including Rachel from Salem, need. And that sounds to me like where we're really failing you here. Which brings me to my fourth and last point, which is one of the great strengths of many of VA is our intense academic partnerships. And so even if we don't have the network and we're not maintaining the network in the community that we need for you to have timely access to, including specialty care, let's make sure that we dig into our academic affiliates here in Oregon or up in Washington State in Vision 20 so we can get you timely access to that care. There's no way that I accept that you need 7 years later to not have the prostheses, prosthetics you need. So let's get that addressed.
I'm your senator, Rachel, and it's just unacceptable. It sounds to me like you've been waiting even longer than 7 years, 2015, and now.
Oh, sorry, I did the math wrong.
No,
8 years, 20.
Yeah, I mean, it just, to go through constant, sort of bureaucratic procedures and red tape and hassles and the like. Here's what I'm telling you specifically, and you got a lot of witnesses. Eric, I, our staff, we're going to follow up. We're going to work with the good people up at the VA here, and we're going to stay at it until you get a prosthesis. It's just not right that a veteran goes that long without something so necessary. And you heard it from the secretary yourself, and it's my job to follow it up. You're our person. You're somebody that we value very much because we care for vets, and we're going to go at it right after the meeting, start after the meeting.
Great.
Yeah, thank you very much. Our next question comes from a caregiver, Ms. Melissa Bagenstos. Melissa.
Thank you, Jose. And thank you, Secretary McDonough, for taking the time to speak with me. My question is, how can special adaptive housing grant process work when working with the VR&E independent living program be streamlined to expedite housing accommodations? With inflation causing prices to rise, it puts in motion a chain reaction, causing contractors to redo bids. We have to downgrade to the minimum of needed accommodations to our home for my disabled veteran husband. And by that, I mean, I have to decide what areas of our home will remain inaccessible to him. As a veteran caregiver, I'm always thinking of how I can reduce my physical transfers because I'm aging with him. And currently, we are not able to get his electric wheelchair into our home, and I have been diligently trying for 3 years.
Melissa, thank you for the question. Thank you for the care provision. Tell me what your veteran's name. What's your husband's name?
My husband is Sergeant First Class Vernon Bagenstos, U.S. Army. And we have been part of the VA since 1996.
Amazing. Well, thank you for choosing VA, and thank you for being the backbone of his care team. The short answer is you should not have to worry which pot of money or which program in our VA budget the special adaptive housing upgrades come from. That's our job. There's no wrong door at VA. So the bottom line is that there's no reason that you should be stuck in the situation that you're stuck in, Melissa. So let us follow up on this directly with you to make sure that you have the adaptive technologies and changes to your house so you and your husband can be at home in your house and in all parts of your house. And you can be at home in your house not having to compromise your own health. So let us follow up directly with you on this, and we'll get this addressed.
Thank you.
I could envision a whole series of reasons why it is the way it's been for the last 3 years. None of them is acceptable. They would all be rationalizations or justifications.
Yes.
And you deserve more than that. So let us get to the bottom of it, and let's just get it fixed.
Thank you very much.
Thank you. Thanks for asking that question.
Do we have any other questions in the audience? Yes, ma'am.
I might cry.
That's okay.
Thank you all for being here.
Thank you for being here.
My name is Faith Yates. I'm a U.S. Navy veteran. We have 2 dentists in my town that work with the VA, and I went to one through community care.
Yes.
And they said, oh, we don't do that. Like I've got root canal things and crowns and teeth breaking, and I'm getting ready to have my jaw joints replaced here soon. because my TMJ is so bad. And I'm having a hysterectomy on my birthday.
Oh,
Coming up here, so there's going to be a week or so probably, I don't really know, when I'm not going to be able to go to the dentist. And I'm supposed to get my teeth fixed before I get my jaw fixed.
yes.
And last year, I had C. diff and had to reschedule all these appointments.
Oh.
And then in January, I got COVID and I had to reschedule all these appointments. And it makes me sad that, I mean, I can't be a jerk though. You know, I'm not gonna show up to somebody's hospital sick for an operation.
Right.
But I have been thinking, surely it is somebody's job somewhere to reach out to community providers for all things. I have to go to San Francisco for my jaw. There's no TMJ people in Oregon in the VA system. And I get your surveys. I, in my heart, am a technical kind of person, and I have ideas, and I have feedback, and I have questions, and there's a litany of things. I could keep you all here for weeks, and I just kind of want to know who we should reach out to when it's like, why are you asking these questions and not these questions? Like, this is something that's more important to me than what you're asking about. And I don't know. I'm not sure who the right people are to reach out to, because, dear God, the online thing, we need an API to connect VA people securely with a bearer token to home users, because every time I have an appointment, they want me to bring all my medication. That's like 86 million bottles. So I try to keep my list updated. And there are old prescriptions, outdated prescriptions you can't renew online, like you can't get what. All the people at the VA are exceptional. I have never received such amazing health care in my whole life than I have in the VA. And if I can wait for an appointment and do it at a VA facility, I try to do that.
Yes.
But with everything being so integrated and not knowing who owns what, sometimes I just wish I could ask someone, who would I reach out to if I had feedback about X?
Yeah.
Or questions. And it's system things. It's like
Yeah.
kind of bigger stuff.
Yeah.
But yeah, I like 2 dentists. We got 2 dentists, and the one dentist can't even,
Yeah.
like he does cleanings and fillings or something. So that's kind of my whole thing. I'm sorry about the rambling there.
No, please, thank you. And you said your name was Tracy.
Faith.
Faith. Okay, I'm sorry, I didn't hear it clearly.
It's
Faith, thank you for choosing VA. And thank you for your service. 1, 2. The dentist thing is a major frustration. It's a major frustration both because, unfortunately, the way we've structured access to dental over time, only a very small number of veterans actually qualify for dental care in the first instance.
Also a problem.
Also a problem. Moreover, there's too few providers in the whole system. But on your question about, this goes back to the issue I was saying earlier about network adequacy. Last year we referred 38 million episodes of care into the community. We have to make sure that we're referring it into the community and that our network is robust. We rely on what's called a third-party administrator. I don't know here if it's Tri-West. It's Tri-West. So they help us maintain the network of providers. We have to be good payers, timely payers, good partners to them. But we also are right to expect that we're paying them, you know, a fair bit of money for them to help us manage a robust network. This is one of my real frustrations, but look, it's mine. You don't need to know about the frustrations, but we need the third-party administrators to earn the taxpayers' dollars here. Brings me to my last point, which is the way I see this is, and the way David sees it, and Teal sees it, our team sees it. We work for you, right? We don't work for an insurance company. You know, like I know who nominated me, the President of the United States. I know who confirmed me, Senator Wyden and his friends. Okay, but I know who I work for, and I work for you. So how can you get your feedback to us? You have a veteran patient advocate in this building, right? You go straight to him, straight to her, right? That goes straight line to David, okay? If you want to reach me, it's dennis.mcdonough@va.gov, okay? That's Dennis with one N, okay? So we work for you. That's the design here, okay? That's the expectation here. And if you're feeling something different, it's a bug. And let us work with you to get rid of it.
Can I just ask a question? Because I thought I heard you say at the beginning you were trying to get access to Medicare?
Oh, no, medical information.
Medical information,
Yeah.
okay. You were trying to use the VA system for your dental services, okay. That takes care of one issue because, as you know, sometimes the VA and Medicare, intersect. And in fact, we had a hearing in the Finance Committee just this week because, Medicare was just half a loaf when it began, and now so many people are falling between the cracks. Now, the Oregon Dental Association, which is the private group, always says that they're interested in helping people who are falling between the cracks. So what we're going to do, Eric and I, is we're going to be on the phone to them this afternoon. And we're going to say we just heard from a veteran who's gone all the way around the mulberry bush many, many times. And I'm going to underpromise here and see if I can be useful, because I just don't think it's right that a veteran like yourself is supposed to be hauling around 80-some prescriptions and medical records and all of this razzmatazz. So we'll start this afternoon. We'll work with the Secretary's people to try to sort this out. But I do know that the Oregon Dental Association, which is the association of all the dentists. What town do you live in? Beaverton. All the dentists in the state belong to this organization, and they say we're interested in helping people who are in need, so we're going to be calling. Okay? All right.
Thank you, Senator. Our next question comes from Air Force veteran Casey Barlow from Ohio. Casey, over to you.
Good afternoon, Senator and Secretary. Thank you so much for taking the time to answer our questions today and for spending time with us. We really appreciate it. My question is related to the comment that the Senator made earlier regarding workforce. And we know that we have an aging veteran population, and we also have an ability that, where we can't get the workforce we need, and that's not unique to the VA. That's across all of our communities. So I wonder if you could answer the question, Secretary, regarding the impact on the long-term capacity of the VA medical centers as a result of implementation of the Pact Act.
Yeah, excellent question. Casey, thank you so much. And you were very generous to thank us for being with you. Our thanks go the other way. My thanks go the other way. So thank you very much, Casey. So we've done a kind of a step down of, well, let me answer the question in two ways. First, we believe that to meet the care needs for the year ahead, we have to hire 52,000 people in VHA this year. Halfway through the fiscal year, we're ahead of that target for the first time in many years. In fact, we've just had the two best hiring quarters in the first half of fiscal year 2023 that we've had in 25 years. In particular, we've had very good hiring quarters for nurses, registered nurses, licensed practical nurses, and nursing assistants. So, and there's no tighter market in healthcare than for nurses. So that tells me that something's working. So what's working? Well, Care providers really like the mission at VA. They get to take care of you all. What could be better? Taking care of our heroes. Second, nurses who left to go to the traveling nurse corps because there were more attractive salaries there in the height of the pandemic are coming back. Now, this is anecdotal, but I think it's an important anecdote. They're coming back, one, because they realize that we're pretty competitive on our retirement benefits, for example, and we're very competitive on how we practice our nursing. So in the community, they might be one nurse to 3 people in an ICU or to 4 people in an ICU. But with us, our nursing ratios are such that we would never allow something like that. So they know that there's patient safety risk to being elsewhere, and they want to be part of a veteran-centered, veteran patient-centered care provision. Third, we have new authorities that Congress gave us in the Pact Act and in the RAISE Act, which was nurse-specific, that allows us to pay more and to pay differently. We can now pay more student loans for a nurse who got his certification after leaving the service at community college. Or we can pay more relocation bonus, or we can pay a retention bonus at the head of the year rather than at the end of the year. So those are 3 things that are working. So that means I think we're going to be pretty good, Casey, this year. And then next year it will be another fight for us to make sure that we keep our people, train them, and, encourage them not to go somewhere else. The last point I want to make is we've done this big assessment, a step-down assessment. How many veterans we think qualify for access under the Pact Act? That's over 6 million. But we think it because there's a bunch of Vietnam vets who we don't have good records for because their records were destroyed in a fire at the National Personnel Record Center. So there's about over 5 million who we know for certain qualify based on where they served geographically in Vietnam or in Central Command, 91 to 2021. Then we've done a further step down. How many of them do we think get their care at VA and how many will get it at TRICARE or through their private provider? How many will get it through Medicaid? The last step is we ask, of those, what kind of care will they need and what do we need to provide care to them for? Overwhelmingly, our actuaries and our strategy people say the thing we need more than anything is mental health care providers. So that's why you'll see us prioritizing these near-term care requirements year by year, but over the life of VA, we're going to be prioritizing mental health care because that's what we owe our vets. That's what we know our vets are going to be seeking, even as we take care of all the other things and rely on our partners in the community for dentists, for specialists, to ensure that we can get timely access to all the care our vets need. But again, it's quite clear to us that what the outcome of the Pact Act is going to be, even greater demand for mental health care.
Mr. Secretary, can I just touch on this mental health issue? I want you to hear this straight and simple. Every single bill that comes up in the healthcare area in the Congress is going to be a battle, as far as I'm concerned, for improving mental health care. And let me give you a quick example. In the gun safety bill last year, Senator Mike Crapo, Republican of Idaho, and I went to the bipartisan leadership and said, we've got 6 provisions here in black letter law so we can get started in terms of the mental health battle. We got funds, for example, for the hotlines that fight suicide. We got funds for the schools, particularly assessing the kind of dangerous kind of situations where somebody's got, a problem at home. We got more than $10 billion for training in behavioral health. So we're making a start, but I want you to know, and you are hearing it from me, our committee is the lead committee for health care as it relates to everybody except veterans, essentially, because fortunately, Dennis is the secretary of that. But every mental health bill that goes through the United States Senate, every health care bill that goes through the United States Senate is going to have a focus on mental health. And that's a pledge. And if anybody questions it, you may know the Wyden story. My brother was schizophrenic. For years and years on end, we went to bed worried he was going to hurt himself or somebody else. So we are all in on this fight, and the secretary summed up the challenge as well as anybody could, because we know what happened during the pandemic. All those veterans isolated in rural Oregon, talk to the people who run the anti-suicide hotlines, and the administrator knows it because he got those calls too, and we talked about it. We are making what the secretary said, urgent business, mental health.
Thank you, sir. And for those of you listening and watching, for more information on Pact Act, go to va.gov/PACT for more information. We're going to go to our last question from a veteran service provider in New York City, Leora Shudovsky. Please ask your question.
Hi. Thank you so much. I'm honored to be here asking a couple of questions on behalf of student veterans. Student veterans who will be starting their college journey in fall 2023 may not be aware of Pact Act benefits for which they may be eligible. As someone who's the director of a program that helps connect student veterans with benefits, I'm asking, is there any possibility of extending the special health care enrollment period to the end of calendar 2023 to help ensure any student veteran has time to figure out eligibility and not have it fall through the cracks of the start of their semester? And if there's time, I have a second question.
Okay. I think what we'll do, let me answer this one, and I think we should take one last question from the room here, and then we'll let you go. We've detained you long enough. You might call the authorities and demand your release. Leora, I think the special medical enrollment period is established in law. But I will confirm that, meaning we can't extend it ourselves. But I will double check that. But I want to make a very special plea and ask for your help and ask everybody's help in the room. For any veteran covered by the Pact Act. So those are Vietnam veterans who are exposed to Agent Orange, who now have a presumptive connection. If you have hypertension and you are exposed to Agent Orange and you are in Vietnam, you are presumptively covered. So Vietnam, or any veterans from 1991 until 2021 in Central Command. Okay? We need you to file your claim before August 10th, 2023. Because when you do, your benefits will be backdated to August 10th, 2022, the day the president signed that law. So please don't wait because you think we might be able to extend a deadline. There is a fundamental incentive to file your claim before August 10th, 2023, because it'll allow you to backdate all those benefits to August 10th, 2022, okay? And on the express question, Leora, we'll make sure that we're making sure that we are prepared for the fall enrollment date for all of our student veterans. I just came from meeting with student veterans at Portland State, and we addressed many of these questions there, so we'll make sure that we're getting that guidance out to the field.
Okay, thank you, appreciate it.
Thank you. Let's take one last one in the room after all the patience that everybody's shown us here.
Yes, sir.
See that? Just like a vet.
They're like
always
the Senate.
always letting somebody else do it.
The Senate yields to each other.
Last question.
Thank you, Mr. Secretary, for being here today, and Senator Wyden and Jose as well. My name is Christian Berge. I am an employee here at the VA. I'm also a veteran at the Westland Seabach My question well, first of all, super excited to be here today, and then even more excited to hear the Secretary of the VA use the word ass-kicking in the middle of a town hall. So
It's
that
also
was,
Holy Week.
you're good in
It's
my
Holy
book, sir.
Week.
That was
it's the week of
fantastic.
Passover. I'm sure I.
That was it
So
was
forgive me.
fantastic.
You can repent.
My question for you is, I heard, was doing a little rumor control stuff last night that I believe you've addressed before, but I wanted to ask you about, was that there was some mention of income limits, about that families and veterans are only going to be able to make a certain amount of money. And once they reach that limit, that their service-connected supplement money, if you will, is going to be taken away.
Yeah.
And so I wondered if you would address that.
Yeah, thank you very much. There is a rumor that you may have seen on military Twitter, or among your battle buddies, or in your community, that somehow one of the ways Congress would propose to save money is to what they call means test VA benefits. So say that if you make a certain amount of money as a veteran, you would have to sacrifice or give back your benefits. President Biden would not support that, would not sign that into law. There is nobody in the Senate and no one in the House who is proposing that, Republican or Democrat. This idea came from the Congressional Budget Office, which is just a think tank, in effect, that comes up every year with ideas that might be able to reduce federal expenditures. Inasmuch as it's their idea, does not mean anybody is proposing it. And in all cases, I can speak definitively on my behalf and on the behalf of the president to say that under no circumstance would he sign such a provision.
Not going to happen. 4 words.
That's the best way to say it. So thank you very much for asking it. Thank you so much for the honor to be in your presence and to have the opportunity to serve you, to work with you. It is the thrill and the honor of my professional lifetime to work on your behalf. And if there's something that's not working, let's get to the bottom of it, okay? And we'll see if we can be as trailblazing as Lori Reed is trailblazing, and as each of you is trailblazing to get this stuff done. So thank you so much.
Thank you both very much. Lastly, for those watching, for those here today, if you are not signed up for the Vet Resources newsletter that we push out every Wednesday from our office, it goes to 13.1 million veterans. I'd encourage you to sign up at va.gov/vet resources, and we'll put it up on the screen when we end here right now. But this Vet Resources newsletter will allow you, it'll give you the information like what we're doing here today, when we're doing them, as well as free things around the country provided to us, veterans, every day. So please sign up for that so you're in the know with what we're pushing out every single week. And again, if you ever have any questions, know that we're available 24/7 at 1-800-MyVA411. If you have any questions, it's manned 24/7 again, and that's 1-800-698-2411, and that number will be up on the screen as well. Thank you, everyone. Have a great day. Safe travels home.
Thanks, everybody.
Thanks, everybody. Good job.
All right.
Well said.
Thank you, brother.
Well said.
That's good.
Really well done.
That's good. Awesome.